If you have type 1 or type 2 diabetes, you should be careful during the COVID-19 coronavirus pandemic. These people may have more serious complications than someone without diabetes. This is because high blood sugar weakens the immune system and makes the person unable to fight off infection. The risk of serious coronavirus infection is even higher if people with diabetes have other health problems, such as heart disease or lung disease. COVID-19 infection coronavirus disease -2019 is a double challenge for patients with diabetes. The first challenge is that diabetes has been reported to be a high risk factor for exacerbating the severity of viral infections. The second challenge is that optimal blood sugar control during this period is difficult. According to a study conducted with more than 1,300 patients infected with respiratory COVID-19 infections, 1 in 10 coronavirus patients with diabetes died within the first 7 days of hospitalization. The results of this study were published on May 29 in the Diabetology journal. Diabetes risk factors for COVID-19. For COVID-19 patients, diabetes is a high risk factor that causes the patient to be hospitalized or possibly die. As data from several studies in China show that diabetes is a comorbid disease occurring in 22% of deaths. The number of comorbidities is also a predictor of mortality in COVID-19. In addition to diabetes, the common comorbidities are hypertension, about 20% of cases, coronary artery disease, 16% of the cases, and lung disease, accounting for 6% of cases. Diabetics with COVID-19 are more likely to die. According to the US CDC, people with a history of chronic diseases such as diabetes, hypertension, and chronic respiratory infections often have weak immune systems, reduced resistance, so they are susceptible to COVID-19. Newly research shows that people with diabetes are 4 times more likely to die, and hospitalizations are longer after nCoV infection. The scientists looked at health data for more than 1,000 COVID-19 patients in the United States from March 1 to April 6. Among them, 40% have diabetes or hypertension. Results showed that diabetic patients had a hospital mortality rate of 29%, much higher than the 6% in patients without background disease. In addition, 42% of patients with diabetes but not previously diagnosed also died. What causes people with diabetes become vulnerable subjects, knocked out, by COVID-19? When infected with the virus, the body is not strong enough to resist will launch a series of disorders associated with chronic disease as diabetes, complicating treatment. It is a fact that people with diabetes are at higher risk of infection, including influenza and complications associated with secondary pneumonia. Patients with diabetes have impaired immune responses including impaired macrophage function, impaired T-cell function and immune cytokines. Poor glycemic control weakens the immune response to the virus and increases secondary bacterial infections in the lungs. Not only infected with coronavirus, diabetics with weakened immune system are more susceptible to other infectious and inflammatory diseases caused by bacteria, virus such as tuberculosis, skin infection, urinary tract infection, female fungal infection vagina. Diabetes treatment with COVID-19 infection. Poor blood sugar control is a high-risk factor for serious infections and other disadvantages. Pneumonia can be reduced with good blood sugar control. However, the problem of treating hyperglycemia during COVID-19 infection is not simple. Patients may have to use corticosteroids. Fever patients, the diet of patients changes. To maintain optimal blood sugar, be sure to closely monitor blood sugar and adjust early hypoglycemic drugs. For type 2 diabetics, insulin treatment is always a priority and needs to be started early. For patients who have used basal insulin before, it is necessary to supplement the launch insulin bolus to ensure blood sugar. For patients with type 1 diabetes who are receiving basal bolus insulin therapy or on continuous insulin pump therapy, the dose of insulin should be adjusted regularly, in addition to regular ketones testing to avoid hypoglycemia of patients who are with reduced food intake. Add insulin bolus to avoid severe hyperglycemia as well as ketoacidosis. Diabetes is a chronic disease. Each stage of the disease needs to be adjusted so that blood sugar as well as other cardiovascular risk factors such as blood pressure, blood fat, weight are under optimal control but less affected. Most drug side effects. If you must go out, diabetics stay at least 6 feet away from others and wash their hands often. Conclusion: diabetes patients are a group of patients at high risk and complicated when COVID-19 infection. This group of patients needs special attention in treatment to minimize the risk of death. You want to learn more about diabetes and information about this disease? Please visit our website, forourhealthy.com.